Hi, my name is Cynthia and welcome to Meditest.
Hello everyone, my name is Dr. Bharatvyas Marla. I'm a senior consultant physician and specialist in cardiology and diabetology.
So today we want to discuss about a topic which is related to diabetes. It's called oral hypoglycemic agent. So we want the doctor to explain to us more about it.
Yeah, oral hypoglycemic agents are the first line drugs which we use for treating type 2 diabetes.
Yeah.
Okay. See, oral medicines we don't use in type 1. We use only in type 2. Okay. And these are the first line agents which we use to treat diabetes. Okay. There are several classes.
Okay.
So we'll discuss some classes today. Okay. We'll discuss something like metformin and sulfonylureas. Okay. Metformin class is also known as biguanides.
Okay.
Okay. Biguanides are the first line. Basically, when we are treating type 2 diabetes, in the literature, it is mentioned that we have to use an anchor agent. Okay. Anchor agents are biguanides, that is metformin, sulfonylureas. Okay. There are many drugs under sulfonylureas, or thiazolidinone redoxines, which we are now no longer using, but in some cases we may use them. Okay. Either of these three classes we have to use as anchor drugs. Okay. So in that, the first line treatment is metformin. Okay.
So that is after someone has been confirmed they have
type 2 diabetes.
Type 2 diabetes.
For diagnosing somebody to be suffering from type 2 diabetes, we have to do a test by name HbA1c. Yes. HbA1c is the definition of diabetes. Okay?
Yeah, that's true.
And when we do HbA1c, and when the HbA1c value is above 6.5, we classify that person to be suffering from diabetes. Okay. And we don't usually start medicines for the first time diagnosed to diabetes patients if the HbA1c is between 6.5 to 7. Okay. Anybody who is having a HbA1c value above 7, we start oral medicines. And the first one we start usually is metformin.
Okay.
Yeah. Metformin is a time tested medicine.
Okay.
It's more than 50 years old in the market. And the speciality about metformin is that nowadays it is being researched in regenerative medicine. Okay. It is the branch of medicine which studies extending lifespans. Okay. And metformin is the medicine being investigated in regenerative therapies. Okay. Apart from that, metformin is the only medicine that is proven to increase lifespan in the entire English pharmacopoeia. You take any other drug, no other drug has been proven that it will increase lifespan, but metformin has proven that.
Do you think people can misuse it?
There is nothing like misuse of metformin. Usually it doesn't happen. Okay. Usually people who are not doctors, they don't know about all this information. That is the first thing. And second thing, there are also so many myths about metformin. I have seen some of the social media videos saying that metformin is bad. It's not like that. Okay. Metformin is not used in only some specific situations, but for every patient with diabetes, usually we prefer treating them with metformin. Okay. The specific situations under which we don't use metformin are one, kidney disease. Chronic kidney disease, usually we don't prefer metformin because kidney disease patients, they tend to have something called acidosis in their blood. The acid content in the blood will increase and metformin worsens it. So usually we don't give in chronic kidney disease patients. Not in everybody. In some people we still give it who are not at very high risk for acidosis. Okay. In kidney disease patients we don't give. And we don't give metformin also in liver disease patients. Again for the same reason that it can worsen the acidosis in liver patients. And also metformin can worsen the liver disease. So that's the reason why we don't give metformin in liver disease patients. And third category is also there. Some people are born in such a way that they don't tolerate metformin. The usual side effects of metformin are acidity. Not in everybody. We don't see acidity in 80% of the patients. In 20% of the patients we see. But in certain people who are prone, genetically prone, in them metformin causes very bad acidity and we usually don't give in them.
Okay. So like in a scenario whereby we have a cardiovascular disease and someone also has diabetes. Now, how do you go about it?
Metformin is preferred.
It's preferred?
Yeah. Metformin is the anchor drug and we do give metformin because glucose control with metformin is very good. And metformin doesn't cause the second class of the drugs I told you, sulfonylureas. So sulfonylureas cause what is called beta cell burnout. That means they stimulate the pancreatic beta cells of Langerhans, which produce insulin, to produce more and more insulin to control the sugar. But metformin doesn't work on beta cells of Langerhans. It works by peripheral mechanism. That means it works by acting on the liver and muscle tissues, thereby reducing the sugar quantity in the blood.
So if I may ask again, so how long should this patient be doing checking their HbA1c?
HbA1c should be checked every 3 months ideally. When you check
for those who are diagnosed,
and who are on treatment, even those people who, say for example, I told you between 6.5 to 7, usually we don't give medicines. We ask them to do the physical exercise, controlled diet, all these things we'll try first. Okay. In those people also, doing HbA1c every 3 months is a very good idea because we can control blood sugar. The problem with even practitioners is that there is nothing like uncontrolled blood sugar. Blood sugar becomes uncontrolled because the patient is not being handled by a proper diabetologist or a physician, who has knowledge. So uncontrolled diabetes is a myth. It's not a reality because every sugar can be controlled.
So another question, do you think these drugs are being sold in the counter, like someone can just access them?
Metformin is actually not over the counter medicine, but many times usually pharmacists don't hesitate to sell metformin because it is specifically used by diabetes people.
So it's a sure deal that it doesn't have any side effects?
It has side effects. I told you, causing acidosis, causing worsening acidosis and causing gas. I mean, lot of acid in the stomach. These are the things which can happen with metformin, but they are quite low when compared to other drugs.
So any advice that you can share?
Just because I told you metformin is a good drug, it doesn't mean that everybody goes and takes it. It should not be the case. It should be in consultation with your doctor. So, and metformin should always be given to any diabetic patient. Only in very few cases, as I told you, we don't use metformin. Otherwise, it's an excellent drug and it's an anchor drug for controlling the type 2 diabetes.
Just a silly question. Do you think there's a kid who has ever been diagnosed with type 2 diabetes?
Type 2 diabetes usually doesn't happen in children, but in adolescents, not even adolescents, actually young adults, in say around 20 to 20 years of age, there is a type 2 diabetes which can develop. That is called maturity onset diabetes of the young. It happens mostly because of the genetic reasons, and it is a type 2 diabetes which can be confused with type 1 diabetes because it started early in the life. And the same thing like that, in adults also there can be a type 1 diabetes which can present late. That is called late onset autoimmune diabetes of the adults. It's called LADA. Diagnosing that also is very important. Currently, I am treating some 3 patients who have LADA. They respond only to insulin well. They don't respond to tablets.
That's it for today. Thank you.
Yeah, thanks a lot.